The American Brain Tumor Association is pleased to welcome you back to our webinar series. Our webinar today will discuss caring for the caregiver. My name is Andrea Garces, Program Manager here at the American Brain Tumor Association. I am delighted to introduce our speaker today, Vickie Leff, MSW, LCSW, ACHP-SW. Vickie Leff is a clinical social worker with palliative care at Duke University Hospital. She has a long history of working with cancer patients and families, along with other serious illnesses. Ms. Leff has a particular interest and passion in providing support to the caregivers of people with serious illness. She has presented several times for the ABTA over the past few years on this caring for the caregiver topic and other subjects. Ms. Leff has been a clinical social worker for over 30 years. Thank you so much for joining us, Ms. Leff. You may now begin your presentation.
Well, good afternoon, everybody, and this is Vickie Leff, and thank you so much for joining us this afternoon for our talk about helping the caregiver. I'm really thrilled to be able to provide this information for you and hope to leave some time at the end of the presentation to answer any questions that you might have. I've called the presentation Navigating Rough Waters because we know that this is really difficult stuff for caregivers to go through. And I really hope that today, at the very least, you can get out of this some suggestions and strategies for things that are going to help you going forward. I have no disclosures to make, and today what I'd like to talk to you guys about is the challenges that are faced by caregivers for people who have brain tumors. Things like the fatigue that you might feel, the serious role changes you go through, maybe even depression or grief related to how the trajectory of the illness is going, and then how to cope with the sudden and significant neurological and sometimes functional changes that folks go through with brain tumors, and some short and long-term strategies to help you manage these challenges. There are things that you can do today even to help you get through this very rough time. And then finally, how to find some fantastic educational, financial, and emotional support that you may need. So I guess one of the most important things I want to tell you is that there really is help out there. And I'm hoping that the things we talk about today can help you figure out a plan that works for you, because not everything works for everybody. It's not one size fits all, as I'm sure you already know. Help you guys to identify some support resources, strengthen the coping skills you already have, but also learn to recognize your own stress that you're having. Figure out when to ask for help. I know that's really hard for folks. It is for me. And how maybe just finding 15 minutes a day can give you a little bit of strength to help keep going during these tough times. So I'd like to, if you don't mind, just set the table briefly and to help us understand what folks are going through. And my experience with lots of different cancer patients and folks who've gone through brain tumors is it looks like, things are going along just fine, and then all of a sudden, out of the blue, this disaster strikes. And folks generally, you know this yourself, of course, feel a lot or some or many of the kinds of things on this slide about anger and doubt, fear, grief, hope. It feels like a roller coaster, not really sure where to start. There are specific challenges dealing with a brain tumor. And for the next couple of slides, I do want to differentiate a little bit between folks who experience a brain tumor as opposed to other cancers, because there are some specific challenges that are different. And I think that's important in terms of when you're talking to other folks who maybe have gone through other cancer experiences, and there are certainly lots of similarities, but there are some things that really make dealing with a brain tumor a little more challenging, I think. And that has to do with the cognitive and the psychological and behavioral changes that sometimes come along with dealing with a brain tumor. It's different than other cancers. Sometimes the sudden nature of the diagnosis can feel very different. Some of the treatments sometimes are very intensive. Sometimes it's a short trajectory of an illness. And there is, unfortunately, a high rate of mortality, and it does tend to hit a lot of young folks. And I think that that's a little bit different than a lot of the other cancers out there and makes it more challenging. The other things that I think make it more different has to do with the emotional and the cognitive piece, the thinking, the memory. Emotionally, I think a lot of folks have told me that they experience a lot of anxiety and or depression, irritability, personality changes. It's kind of hard to figure out, well, is that because someone's going through a hard time, or is that because of the brain tumor? We're going to talk about that in a little bit. And then thinking and memory issues that come up, making it difficult to process information. That has a lot of implications for you as the caregiver, and then short-term memory problems, which has its own problems as well. Concentration issues like confusion, maybe getting distracted, makes it hard to plan. And what we call executive functioning, where your judgment is involved, sometimes can be impaired. And that makes decision-making often very difficult. All of those things, the changes in personality, the mood swings that can come along with brain tumors and treatments, the reduced mental capacity at times, and then the physical impairment, that can lead to a decreased quality of life and an increased dependence on you, the caregiver, at home. And that's the challenge. I just put in this quote because I like it so much, that the couple saying, I'm sure the healthcare physician is quite talented, but I understood nothing, they said. It's so important. The caregiver is so important in any treatment of cancer, and certainly brain tumors as well, in terms of getting the information you need, understanding what people are saying, having that other set of ears is so critical. One of the things that I'd like to challenge you to think about as we go through this discussion is that balance between hope and uncertainty. And I mention this because this comes up in a lot of my discussions with patients and families of how can they coexist? How can you hope for something at the same time as you're uncertain about what's going to happen? And I think this is a huge challenge, and it's very, very hard to balance this. I'm not sure that it ever gets quite balanced, but I encourage you to kind of think about this as we go forward, about how you manage that balance of hope and uncertainty. So let's talk about recognizing stress for caregivers, because it's certainly out there, and I'm sure that all of you could tell me a lot about the stress that you're experiencing. So I wanted to write down just a couple of things about things that both patients and caregivers face, the psychological, physical, and financial stress that the caregiver and the patient feel. I suspect that many of you have had experience with feeling anxious or depressed, had some sleep disturbance, fatigue, frustration, isolation. One of the things I think that's unique and challenging for folks who are dealing with a brain tumor is the role changes that it can cause because of some of those physical, psychological, and cognitive changes that people go through that are quite sudden and very difficult to deal with. For the patient, of course, it's a huge sudden change, often means intense treatments, maybe surgery, maybe chemotherapy, role changes, that uncertainty of knowing what's going to happen in the future. And here in palliative care and at Duke, we like to say we hope for the best, but we like to plan for the worst. Some of the stress and the physical symptoms that go along with a brain tumor can be really, really confusing. And I really want to stress something about this. So some of these symptoms of stress can be irritability or anxiety, depression, feeling overwhelmed, memory and concentration issues. And I've heard from a lot of people that what's difficult is trying to figure out, well, what's a normal reaction? What's due to the stress of having an illness? And what's the result of the brain tumor itself and or the treatment? So I put at the bottom of this slide how important it is to get a differential diagnosis. And what I mean by that is that if the person with the tumor is experiencing some of these symptoms and you're not sure whether it's from stress or maybe it's a result of the tumor, we want to be able to rule out what's what as much as we possibly can. And so I'd really encourage you to bring those symptoms, maybe even taking a log of it, bring it to the doc, to the oncologist, and have them help you sort that out. It's really, really important in terms of what treatments can be provided. If someone's anxious because they're dealing with this serious illness, the treatment for that is different than someone having a neurological reaction that manifests that looks like anxiety. So it's really important to get that differential diagnosis. And differentiating between the symptoms and reactions really makes it hard. but we always want to treat it. So I guess the reason I'm focusing on this a little bit is because symptoms should always be treated as best they can and not just pushed aside, well, that's just a reaction, because reactions can be helped as well. The realities for the caregivers can be equally devastating and difficult. You're having to put the patient first. You're probably exhausted. It can be very rewarding and meaningful, of course, being able to help someone that you love or care for, and helping them through something difficult. But it can also, at the same time, I think, feel lonely. And there is a lack of focus from the team on the caregiver. I certainly want to admit that right up front, that in medicine, we're really focused on the patient. And sometimes I think it's hard for us to remember that it's a team sport, and the caregiver is going through their own difficulties, and that needs to be tended to as well. There's hardly any preparation for this new role for you as a caregiver. There's not a lot of ramp-up time. Things probably happened really quickly, and all of a sudden here you are, you're having to be a caregiver, and it's not something perhaps you've done before. Or maybe it is for somebody else. You have very little personal time. This is from an article, so I'm not just making this up. This is from a study that was done specific to primary brain tumor patients, that the caregivers have no personal time, generally only 3 hours a week, which is nothing. Their finances are stretched. 41% reported reduced hours working or needed to stop working. And I'm sorry to report that this particular study noted that 50% of caregivers, folks who had a primary brain tumor, experienced depression. I hope that maybe we can provide some ideas for you so that we can at least tend to that a little bit better. I don't think we do a very good job as a medical profession about that. And this is from another study that was done, Forgotten Voices, Lessons from Caregivers of Persons with a Brain Tumor. And just noting what you already know, which is it's physically exhausting, express feelings of anger and frustration and guilt for losing their patients. I hope that one of the things that, if you're listening, that you walk away with is knowing that the feelings that you have, which probably vary quite a bit, are very normal, and that anybody would have them, and that everyone does the very best that they can. I picked up this quote, this next one, from the ABTA website. They have a wonderful forum. They've got a lot of resources, and one of them is a forum where folks, caregivers, can share some of their thoughts with each other. And this one was particularly striking to me. I think seeing my soulmate change a little more every day is the hardest thing I've ever had to experience. I miss my best friend so very much, and he's still here. So the signs of stress that I would ask you to look for as the caregiver, so we're just talking about you all, trying to figure out what's stress, what's normal, when do I need help, right? So normal signs of stress are things like feeling tired and run down, like all of us do from time to time, having trouble concentrating, feeling more resentful than you might normally in a day, difficulty sleeping, overreacting to minor issues, so, being kind of irritable. Your own health problems getting exacerbated, getting worse is something to look for. Anxiety, that feeling of not being able to think about anything else. Depression, feeling really, really sad and isolated. Wishing for this to end. Those are all very common signs of stress. I would expect any caregiver of anybody dealing with someone who has cancer, let alone a brain tumor, to experience some of these, if not all of these. I hope not all at once, though. So let's figure out maybe what we can do about some of those as well, because stress leads to burnout. And that means that you'd be feeling constantly exhausted, neglecting your own needs. Your life is revolving around your caregiving, no time for anything else, can't relax even when you have help, getting more and more impatient and irritable, feeling helpless and feeling hopeless. And those are not good things to have to feel. I'm sure that perhaps some of you are already feeling this way. It's also important to take a moment, I want to take a moment to talk about signs of depression. And I'm not really talking about that kind of having the blues sort of thing that every person on the planet feels from time to time, but a little bit more significant feelings that last a little bit longer than normal and are a bit more severe. And that's how, as a clinical social worker, I would be looking at and trying to diagnose if someone had depression. It's about the severity and the duration of these symptoms to think about. So changes in sleep that last more than 2 weeks, changes in your appetite that might last for more than 2 weeks, an overwhelming feeling of sadness and finding no joy in anything that you do, feeling terribly isolated, maybe withdrawing from your friends, and that everyday feeling of just not having a good day never leaves you. And these symptoms start to interfere with your daily functioning, then it's a problem, but it's also something that can be treated, and that's really important to know. And I also want to spend a moment talking about the difference between grief or anticipatory grief, worrying about losing somebody in depression. And there is a difference. So grief has a little bit more to do with feeling sad or maybe thinking about anticipating, adapting to what it might be like without someone. Even though things may go perfectly well, I think it's very normal for folks to think about what would it be like if things don't go well. You know, that hoping for the best but planning for the worst. And grief in general tends to kind of come in waves. One moment you're feeling okay, and the next, kind of out of the blue, you just hit with this, oh my gosh, I don't know what I would do. Depression, generally speaking, kind of has a little, doesn't come in waves as much as ongoing feelings. And the reason that this is important to differentiate is so that first you know that these feelings are normal, but also if they last a long time, or like we were talking before about the duration, that there are things you can do and there is help that you can get. And I don't want you to feel isolated or feel like there's nothing that can be done about this. This is the way I'm supposed to feel. So I just wanted to differentiate that. It's really so important to know when it's time to get help. I don't know about you, but I know it's hard for me to ask for help because I like to think I can handle everything. And sometimes you can't. So if those feelings start to get in the way of your day-to-day living, keep you stuck or frozen, and you're the best one to know that, then I think some help would be useful for you. And that can come in a lot of different ways, and the ABTA has a lot of fantastic things that can help you as well. Just 3 of the things that come to my mind are thinking about medications for anxiety or depression, therapy or counseling. Of course, as a mental health professional, I'm a huge proponent of this. I think having some time to yourself that's with someone who has no prior history with you, no judgment whatsoever, a place that you can go that's just for you to kind of unload and think through and process what's going on for you can be enormously helpful. I realize while I say that, though, that finding the time to do that is extraordinarily challenging. So I throw it out there as a great idea, but I do realize how hard that is to put into a day that you're already slammed and probably up 24 hours a day anyway. A support group, if you have the time, can be a wonderful thing as well, especially in terms of helping you not feel as isolated as you might feel. Again, it's a time issue. You know, when do you find the time to go to a support group? Well, thanks to the internet, there's a lot of stuff online that you can do that you can fit in when it works best for you. And I would encourage you guys to take a look and see what works best for you. There isn't one thing. There isn't one magic pill or one magic counselor. It really depends on what's going to feel best to you, and you're all different. But I do want to encourage you to think about asking for help when you're feeling overwhelmed. And remind yourself, I'm a big cat and dog person, remind yourself that it's not forever, that we can all use help at times. It's not going to be always. I want to also spend a moment to talk about what doesn't help. And I put this cartoon up about putting your head in the sand and just kind of ignoring it. Doesn't really help for terribly long. It can help maybe getting through a day, but it might not help you in the long run. So that negative self-talk of, oh, I should be doing this so much better. Why can't I be positive and perky all the time? And it's probably because you're exhausted and you're worried. What doesn't help is isolating yourself and that feeling that it generates from that saying, you know, I'm the only person going through this, no one can help me. And you are, your situation is, of course, unique to you, but you aren't alone out there. There are people that can listen and be present with you and help you in this journey. Avoiding dealing with your emotions, generally speaking, kind of like not dealing with a clog in the drain, it just kind of gets worse. And so some of the suggestions that I have later on have to do with kind of getting those emotions out on the table. And then not asking for help is never something that's going to be helpful. And why it matters, I love this quote from this great article for psychosocial care for family caregivers, because when the patient-caregiver dyad is treated as a unit of care, which we should all do, it contributes to the well-being of both the patient and the caregivers. So it's like that saying of putting your mask on first to help the person next to you. It's just as important for you to take care of yourself in order to do what you want to care for your loved one. So let's talk about what can help now that I've painted this picture and I'm worried about you guys being depressed and anxious. So the most important thing that I hope you walk away with today and learn about is that you're not alone. And I think that's really, really important. How to strengthen the coping that you currently have is also really important. I'm sure you're all doing the very best you can. Some things work better for you than other things, but I wanted to go over a little bit how these certain coping strategies can really help you and why they help you. So for instance, we talked about just a minute ago, not letting your emotions just kind of be untold. Acknowledging how you're feeling helps you not just to get it off of your chest, which can sometimes feel great. More importantly, though, it helps you know what you need. And I think that's critical, because then you can come up with a plan for yourself. Prioritizing what's important for you, maybe even hour by hour, afternoon by afternoon, day by day, is really important so that you can have a sense of knowing what your limits are. I know you're all Superman and Superwoman, but we all can't do everything. And we need to know what our limits are to be able to set those priorities and then set goals for ourselves and have success. I can't stress this enough. I know that being a caregiver in a serious situation is so overwhelming, and perhaps it feels like I can never get anything done, I don't have any time, things aren't going well. But setting some small goals for yourself and experiencing success with that, even if it's something like I'm going to walk the dog for 5 minutes today, doing that and having success with that, you'd be surprised how much energy and focus that can help give you. I know that sounds trite, but give it a try and see what you think. Asking for and accepting help can help you not to feel isolated. And reevaluating often. Thinking about what worked a month ago is probably different than what works today, right? The situation has changed. Maybe the medications have changed. Lots of things can change in a short period of time. So it's something you really have to reevaluate over and over again. What's working now? How did I cope then? Is that still working now? Do I need to kind of change it because things are different? And then rinse and repeat. Do it again, accepting that there's going to be ups and downs. It's going to be in waves, and taking a look at what works for you. Acknowledging your emotions is really, I think, critical, because you can't fix or change something if you don't see if it's there. Admitting those scary feelings and thoughts, putting it out there to think about, can be really helpful. That doesn't mean that you have to do it with your partner or your loved one. You can do it just with yourself by writing them down. But I think acknowledging that they're there is a really helpful thing, because it'll help you think about what you can do about that. And by the same token, acknowledging that your role has changed makes it possible to think about how to cope with that. So writing it out, back in the 70s, we called this just journaling, but now it's called reflective writing, which I guess sounds a little bit nicer. Taking a few minutes once in a while, it doesn't work for everybody, to kind of write out what's working, what isn't working, as a way to identify your emotions is really helpful. We talked a minute ago about prioritizing, and I think this is really critical when you're dealing with anybody who's dealing with a serious illness, figuring out what's the most important thing. When I first saw this, I saw, oh, cleaning the house. Well, that's really urgent, right? Well, it's not necessarily in the face of maybe having a seizure, right? So thinking about what's important, what can be put aside, what needs to be focused on, and revisiting this often, because things are going to change, and looking at day to day, even writing it out, helping you think about what's important right now, what's important today, and how can we solve that problem. I hope that makes sense a little bit. I really encourage everyone to think about bite-sized goals. And by bite-size, I mean that I think sometimes we're all thinking about the big picture a lot and hoping that things go well, and I hope they go well too. But also setting ourselves up for some success and being able to manage things on kind of a smaller, bite-sized level. And maybe that means setting a goal that's just one thing for the day, right? Walking your dog. Using your organizational skills and I like the graphic in this I'm a big Post-its person, and writing down what you need to get done and what you can prioritize and making sure that you're putting things out there that actually can get done. Curing the brain tumor, I wish that we could put that down as that's the most important thing, and it is. But let's maybe break it down into things that we can do on a day-to-day basis to get through this together. Asking for help. I know this sounds so simple, and you're probably thinking, well, Vickie, come on, everybody knows how to ask for help. But I can't tell you how many times I hear from folks how hard this is to do for a lot of different reasons. But I want to remind you that people really want to help you. They just need to know a little bit maybe about what you need. When someone says, how are you doing today, Jane? What can we do to help you? And I'm sure you've got 1,000 things in your mind about, well, I need to do this, this, and this. Well, maybe being concrete with them is exactly what they need to know. I need someone to pick up my dry cleaning. I just don't have time to do that. It's driving me insane. Can you help me with that? So think about and maybe even write down things that people can help you with. There's some things that, folks can't help us with, but there's certainly plenty that they can. And I want to encourage folks to think about that asking for help is not giving up. And it does not mean that you're helpless or that you're not doing the very, very best that you can. It takes courage, I think, sometimes to say, you know what, I need someone to help me with this. I need them to help me, and maybe that'll help me feel stronger. Okay, I'll stop preaching about that. I think it's worth thinking about reevaluating over and over again because things are going to change. They can change quickly. Your role may change several times. And if it's not working, that's okay. Reevaluate it. There's no one way to do something. And I know this is intuitive and hopefully everyone knows this, but I just wanted to take a moment to say it, to be kind to yourselves. You all are going through a lot. It's overwhelming. And I suspect that sometimes you beat yourselves up about how you're doing, but it's important to be kind to yourself. So now I am going to preach just a little bit more, and I apologize in advance. But it's really important to take a few minutes to talk about exercise and sleep. If you can, just have a few minutes a day to do some exercise. It actually really does help a lot. So if you can, just try whenever you can. And sleeping. Sleeping and your mood are really, really closely connected, and I'm sure you know. When you don't get a good night's sleep, you just don't have the strength and the clarity to deal with a lot of important things. So it's really, really important. It can make you irritable, adds to your stress, can actually add to feelings of depression and anxiety, but it can be helped through a variety of improving some of your sleeping habits. And even partial deprivation can have a really significant effect on your mood. So they did this study, cumulative sleepiness, subjects who were limited to only 4.5 hours of sleep a night for 1 week reported feeling more stressed, angry, sad, and mentally exhausted. When they resumed their normal sleep, they reported a dramatic increase in their mood. Now, I can hear some of you saying, I don't have time, I can't, there's too much to do. But again, I think it's so important to remember that you need to take the time to do this so that you can be and take care of the person that you're caring for as best you possibly can. And you've got to have sleep to be able to do that. So not only does sleep affect your mood, but your mental states can affect your sleep, of course. So I suspect that some of you, I know I've experienced this, get into bed and you just keep thinking about all the things you need to do, all the things that you're worried about, and you cannot make your mind stop. It increases agitation, makes it really hard to sleep. And if you're under constant stress, as many of you probably are, you're going to tend to have sleep problems. So there are things that you can do about that. A little bit of exercise actually goes a hugely long way to help with your sleep problems. Any kind of exercise at all can act as a stress reliever. I'm not a huge proponent of sleeping medication, but you know what? If you talk to your physician and that's what they think might be helpful for you, this is an individual thing, then that's what you need to do. Because if you're not getting any sleep, you're not going to be able to be the caregiver that probably you would like to be. So just a note about this exercise thing. Any form of exercise, yoga, anything, can act as a stress reliever. It pumps up your endorphins. It helps you to meditate, and it can improve your mood dramatically. So I have a couple of suggestions for you. One is to think about journaling, or AKA reflective writing. Being able to spend a few minutes writing down what you might be thinking about. You don't have to show this to anybody. This is your private thoughts. Sometimes getting them out of your head onto paper can help you to clarify what it is that you're worried about and think through how you might be able to deal with some of those worries, maybe even come up with some solutions about them. How you're feeling, maybe some of those scary thoughts that you're having that you don't want to share with the person that you're caring for. You can write them down and feel like you've been heard in a way without having to bring them up to the person because it might feel emotionally charged. I think this is really, really helpful. The second thing is using reminders, the Post-its, and also little inspirational things to put on your refrigerator. I know that doesn't take the stress away, but if there's something that you can say to yourself that helps you to kind of keep going, or something that you want to remind yourself, then put it up there, post it. I know that folks don't have a lot of time, but I do want to challenge you to find at least 15 minutes a day that's just for yourself. Whether it's doing a crossword puzzle, walking outside, talking to your dog or your cat. I told you I was a dog and cat person. I think that everyone can find 15 minutes for themselves. Maybe you're going to say, well, you know, what the heck is that going to do? You know, 15 minutes isn't going to do anything for me. But I think you'd be surprised. And the act of carving that time out for yourself, I think, is extremely therapeutic. And then finally, the other thing, and these are things you can do this afternoon. Do them tomorrow if they work for you. You don't have to do all of them, and they're not always going to work in the same way. It's just something to kind of keep in your back pocket as things that might be helpful during times when you're not sure what else to do. The writing down 3 good things before you go to bed, there's actually there's lots of articles about this and a book on this. Martin Siegelman, I think, wrote it. And it's an exercise actually in gratefulness, which makes it sound like it has to be Susie Sunshine, but it's not. The idea of this is to write down 3 good things. I do it at the end of the day just because it's easier. You can do it at any time. The idea is to make a habit of it. Write down 3 good things that happened to you today. These do not have to be monumental or things that you would call into a news station. It can be something like, I really enjoyed my lunch today, or I had a good conversation with my daughter today, or I really wanted to yell at somebody and I didn't. Or I put the right shoes on. It can be anything, but the idea is to take a few moments, either when you wake up or before you go to bed, to think about your day and just identify a couple of things that went okay. They don't have to be fantastic. The idea is to cultivate a feeling of gratitude, not to whitewash or to put rosy glasses on something, but just to take a moment and maybe take a little bit of solace in some of the little things that happened to you, or maybe it was a big thing. I think it's not a bad thing to, that's not the right way to put it. It's a really nice strategy for you to try. And it might feel good to you. It might feel like, that didn't do much for me, but give it a shot and see if you think it might be helpful. If it is and it becomes a habit, I think it can be a really useful tool to help you think about things. The 15 minutes, will it fix anything? Nope. Will it change the reality you're going through? No, not at all. Will it give you a little more strength and focus, maybe to help you deal with what you have to? I think yes. And it really can be anything at all. It's not going to, like I said, it's not going to make a huge difference. It doesn't make things go away, but it gives you a few minutes to yourself to think about what might be helpful. One of the things I wanted to also tell you guys about, which you may already know, is the ABTA, and we're going to go through some of their resources because they're really outstanding. One of the things that they have is a mentor program. And maybe for some of you out there who have been a caregiver for a long time and feel like you'd like to be able to share your wisdom, share your support with others, I'd really encourage you to take a look and see if this is something you'd be interested in, maybe becoming a mentor. So ABTA the American Brain Tumor Association feels strongly, and I agree with them 1,000%, that there's nothing like the support that you can get from somebody who's gone through something similar. It's why support groups are sometimes helpful, and sometimes the online forums are really, really helpful to talk to someone who's been through something similar to what you've been through. And as we were talking about earlier, although dealing with any cancer is obviously devastating, and there are a lot of similarities between anybody dealing with a cancer diagnosis and a caregiver of a cancer patient, I do think that there are real differences and challenges that go along with being a caregiver for someone who has a brain tumor that's quite unique, that I think gets a little bit lost if you're just talking to a general population. So this mentor program through the ABTA hooks you up with someone who has been a caregiver themselves for someone with a brain tumor. You can use it as becoming a mentor or talking to a mentor. And I would really encourage you to think about doing that to share your experiences and help someone get through what you've been through. It's also a great, interestingly enough, it's a really great stress reliever, is to do something altruistic. One of the things, I was just talking with a group of nurses here at Duke, and I was doing a talk on burnout and self-care strategies that can help them have a long career as nurses. And one of the things I suggested to them is, in the middle of the day, if you just put your hand on a shoulder of a colleague and say something nice about something that they've done, that act of altruism, that act of saying something nice is actually going to reduce your stress, which sounds counterintuitive, but try it sometime. It's an interesting phenomenon. I'd like to talk to you guys for a moment about resources in the time we have, and then leave some time for questions. I am going to focus on the American Brain Tumors Association resources, because I do think that although there's a ton of resources out there for cancer patients, I do think that the unique challenges that face folks with brain tumors and their caregivers, that the ABTA has some of the most phenomenal resources for you. I hope you've discovered some of these yourselves, but if you haven't, there are a couple of things that I'm going to point you to. So this is just a screenshot of their primary page, the ABTA's primary page. And if you can see on the right, I'm going to use my mouse. So there's great information for folks who've just been diagnosed. This is the program I was just talking to you about, becoming or finding a mentor. And then this connections piece and support groups and the Caregiver Resource Center are the ones as caregivers that I think you might find most helpful. This is the Caregiver Center website. And on the side, you can see I just wanted to highlight, look at all this information that's available. So depending on what your question is, like one of the things that we talked about earlier is managing some of the physical symptoms of a brain tumor patient or the cognitive symptoms. So this is where you can get even more information, lots more information than what I've given you, managing those cognitive symptoms, being able to identify them, differentiating them from stress reactions, what other people have done to help them with that, when to ask for help, when to go to the doctor, when should I ask the oncologist, is there something that we need to do some testing about? Safety issues, getting the help that you need, tips for extended family, how to talk to your extended family about what can be most helpful. Maybe they're coming over a little bit too often and you want to try to tactfully tell them what would really be helpful. Navigating the healthcare system, huge issue since we don't make it easy for folks, and I'm sorry that we don't. But this is a fantastic resource. You can use it in the privacy of your home. No one's watching you. No one's taking notes, and get more information. This handbook is something that you can download and print. The main sections of it over here is your role as a caregiver, the impact on the family, again, navigating the healthcare system, symptoms and side effects, and then some of the things we were talking about in terms of caring for yourself. So, today maybe what you're interested in is, I'm really worried about my family and how this is going to impact my family. So maybe just open the handbook to the family impact section. And maybe 2 months from now, you're going to have different questions. You're going to have questions about, my role has changed a lot. I'm not really sure how to handle that. I'm confused by it. It's frustrating for me. Well, maybe then you'll turn back to it and read a little bit more about role changes. I'm a big proponent of support groups. I do realize as I say that it's really hard to find the time to do this. So ABT has online support communities, but there's also a lot of value in that face-to-face contact that you can have with somebody. And they have, if you see right down here, it says find a support group. So you just put in your state, and it'll come up with what support groups are available to you close by. I'd encourage you to do that. And again, up here is that mentor program right here, and then there's an online forum. That quote that I read to you about watching someone lose their best friend is from that online support community. Use it when you feel it'd be helpful for you. If it's not helpful, don't use it. I hope, if nothing else, this webinar has been helpful to tell you that all of your different reactions are very, very normal, and that there is no one best way to get through this difficult journey. Everyone's very, very different, and I hope that I've been encouraging you guys to think about what works for you as an individual, not what worked for Aunt Jane or Uncle Lou or the neighbor down the street, because everyone's different. And yet at the same time, we all, that there is a community of shared experiences as well. This is my favorite slide. I'm a very visual person, and I like to think about caregivers standing steady in a thunderstorm. So I think of you guys as this very strong oak tree, I'm not sure if that's oak, standing steady in a storm. Sometimes maybe it abates a little bit and the rain stops. Other times it comes on strong, and it's really, really, really difficult. I wish that we did more for caregivers as a medical community, and I think we're starting to do that a bit more, because it's a team sport. The better you can take care of yourself, the better you can take care of the person that you're caring for, and that's really critical. But we appreciate the fact that it's a very difficult journey. It's a little bit scary sometimes, and I hope you know that there are lots of things out there that can help you when you choose to do that, and hopefully revisit what you need when things come up. There are a lot of things online. I suspect that many of you have already been looking online and trying to access resources. Here's just some of them. And I understand from the ABTA, I'm sorry, I keep saying that wrong, that they're going to send you a link to the YouTube recording, and so you can revisit some of these resources, but there really is quite a lot out there. I think that's one of the benefits of the internet these days, is that people can talk to each other. I'd really encourage you to go to the ABTA's website for particularly their caregiver supports are really outstanding. I gave a couple of references for articles if you're interested. There's actually a fair amount written and studied about caregiver stress, what helps and what doesn't, and we're still working on it because there is no magic answer. I certainly wish that there was, except that you're not alone. There are people that can help you. To be careful about asking for help when you need it, and to lean on each other when you need it as well. I hope that that's been helpful. It's about 2:46, and so I'd like to open it up for any questions that you guys might have and see if I can answer them for you.
Thank you so much, Ms. Leff, for that wonderful presentation. For anyone who would like to ask a question, just as a reminder, please type and submit it using the question box in the webinar control panel on the right-hand side of your screen. Ms. Leff, we have a question here. Many of the caregivers are balancing being both a caregiver for the brain tumor patient as well as having young children in the home. Can you address some of the issues that are faced both by the children of brain tumor patients as well as the caregiver that's balancing caring for multiple people within the home?
That is such a good question. Thank you so much for bringing it up, and I apologize I didn't put anything in the slides about talking with young children. It's kind of a presentation unto itself, which perhaps we can do at another time. First of all, I want to acknowledge that the multiple roles that a parent would feel with being the caregiver for a patient, and also then dealing with their kids at the same time is extraordinary. And so just concretely, I would encourage you to see if you can ask for some help with some of the more logistical issues that might have to do with the kids in terms of pickup and so forth. If the question is more about how to talk to the kids about a brain tumor diagnosis or treatment, then I think that I'm going to give you an abbreviated response, and that is that it completely depends on who the children are, what they're like, and what their ages are. Creating an atmosphere in a family situation that encourages questions is extremely important. You probably already know as a parent intuitively that the things that kids worry about are almost always worse than the reality. And creating an atmosphere in the home, in the car, driving to and from school, asking questions about how they understand things are going, what they might be worried about, is a really good place to start from. At the same time, and I know this is going to sound difficult, to also allow kids in their own way to deal with this, meaning that a teenager who's 14, maybe a 14-year-old boy, might be kind of quiet about this. A 13-year-old girl maybe might be really vocal about what they're worried about, and everybody's going to deal with it a little bit differently. My one caveat is that hopefully wherever the person's being treated for the brain tumor is that they might have child life specialists. I know that there's information on ABTA, the website, about talking with children about cancer diagnosis and treatment. Additionally, though, there are sometimes child life specialists who have age-appropriate information. You know, what I would give and what I would suggest for a 5-year-old is going to be very different than a 16-year-old in terms of books that I might suggest or ways to talk to them about it, information about how to explain what a brain tumor is. Really, really varies on the age. So I would get some assistance if you can from the brain tumor clinic that you're going to. Be sure to include the school and let them know that what's going on. They do keep that in confidence. I would talk to the guidance counselors at the schools. The reason to do that is so that they can kind of keep an eye on the kids and just be looking for any acting out behavior, which would not be uncommon at all. and being able to help you know what's going on at school. So it's kind of a whole other presentation talk, and I hope I haven't glossed over it and been able to answer the question a little bit. So thank you for the question.
Thank you so much for that. Another question we had here was, what are some of the ways that the patient or survivor can help the caregiver? What can they do to give support to the caregiver from the patient perspective?
Oh, what a great question. Thank you. And thanks for thinking of that and asking it. I think that the primary thing that someone who's been through the treatment for a brain tumor can do for their caregiver is to acknowledge that it's a really hard job, and that they understand that it might bring up ambivalent feelings, and that is A-okay. Meaning that sometimes maybe they might have even felt resentful or angry about it, and that's okay, and they understand that. So I think just acknowledging and normalizing the ambivalent feelings and the maybe scary feelings that go along with being a caregiver would be a great gift that someone who's been through a brain tumor could visit on their caregiver, to be able to say, thanks, I appreciate that this was not easy. You probably had a lot of varying emotions and thoughts, and that's okay, and maybe give them an opportunity to share some of those if they feel like they can.
Great, thank you so much. Another question is, what are some ways to manage if the patient resists help from the caregiver?
You guys have a great audience. That's a phenomenal question, and I call it rolling with resistance. And I guess I have kind of two parts to the answer. That one is, if that's something that's normal for their personality, that you're not surprised that they're being resistant to assistance. That's a mouthful. If maybe prior to their diagnosis, they were maybe a little bit stubborn and like to do things for themselves, and not someone for whom it's easy to ask help, it wouldn't surprise me at all that they would be resistant. So, number one, understanding the context. Is this something that's normal for them? Are they normally a little hesitant? Because in which case you're going to have to be really patient about it and try to share why it's practical for you to help them. Maybe saying something like, in order to help you, this is what they need to do to help you help them, if that makes sense, like the Jerry Maguire film. And the other thing to think about is, if it's not in character for the person to be a little resistant, then to see if there's a differential diagnosis of something going on cognitively. That being said, though, that might not change it. And I appreciate that puts the caregiver in an extremely difficult position of maybe having to do things that the person doesn't want to do. And it requires an enormous amount of patience. The other thing I would suggest is having somebody else, maybe somebody on the care team, the doc, the nurse, maybe another family member, making the suggestion instead of the primary caregiver. Sometimes when we hear things from other people, other than that primary person, it kind of makes a little more sense, or it's easier for them to acquiesce to somebody else than to the primary caregiver. So enlist the aid of your medical team. Sometimes folks will come in to us and say, can you please help him know that he can't drive? And that's a really hard thing for people to give up, but very important for their safety. And so as a medical team, maybe we'll write out, these are the things we're concerned about and that we don't want you to do. It takes the burden off of the caregiver to say it so they don't feel as guilty about it. So I'd encourage you to use your medical team to give bad news or to kind of lay down the law about things that aren't comfortable. Have some patience and put it in context with what their personality is like normally. And if they were always a little reticent to accept help, my guess is that they're going to continue to do that. And it's just going to take an enormous amount of patience, and then try other people to be your messenger.
Thank you so much. This is kind of a follow-up question to the initial question regarding the children. Some of the caregivers have children who are grown and have moved on to their own family lives. What are some of the resources that might be available for those children who are grown up but are still experiencing some of the fears and stress levels as children of brain tumor patients?
So assistance for adult children, and that's so well worded because your parent is always your parent, your child is always your child, right? So a lot of the reactions that folks have are in that primary role. So if it's their parent that's going through something difficult, it's not unusual for someone to react as their child, not as the grown-up 35-year-old. So I would direct them to caregiver resources, the ones that the American Brain Tumor Association has on the website about that. Also, of course, if someone's having a lot of difficulty with kind of reconciling being an adult but having a reaction regarding their parent, is individual counseling, I think, can be really helpful to kind of sort that out a little bit. I know it can be expensive and it's hard to find. There's a great website called psychologytoday.com, and you can type in the city and find a counselor that meets your needs, that has specialties, and see what they charge and all that stuff. And I think that can be helpful as well. But there aren't any specific websites dedicated to adult children who are dealing with a parent with a brain tumor diagnosis. So you'll have to look under the caregiver tabs and of the cancer sites.
Thank you.
That might not be that helpful.
Thank you so much for that. We have another question here is, how do you suggest a caregiver address strong feelings or fears and anxiety over the level of care that is needed at the very end stages?
How do you address the strong feelings they have about the level of care that they need? That the caregiver is having strong reactions?
That when it's towards the end stages, how can they manage these types of feelings of anxiety and fear when it's towards the end?
Oh, okay. So if we're talking about the intense emotions that come when somebody is perhaps at the end of life, I would suggest that it's to be expected and difficult and very, very, very challenging and overwhelming. So to that extent, I think everybody would do well to get some assistance with that through either a hospice organization, through their palliative care organization. Hopefully that there's one at the hospital. Hospice in particular has great family support resources available for people, both their medical team, their social worker, their chaplains, their volunteers. They've got bereavement services as well for after somebody dies. It's totally understandable and expectable that you'd have very, very intense emotions and at the same time need a place to put those. So if there's a hospice, even if the person isn't getting hospice services medically, they can call their local hospice and see if there's some resources that they might be able to share, or someone that they could talk to on that staff who are particular experts at end-of-life care and some of the issues and emotions that go along with that.
Thank you so much. And our final question that we have time for, and Ms. Leff, you're more than welcome to add any other final comments to the end of this, is what role does faith or spirituality play in caregiving?
Wow, well, that's a huge question. Wow. So I can only answer that by saying it's huge. It depends on what it means to you. So for some folks, it's the most important thing. For others, it's not important at all. One of the things we ask all the time when we meet new folks in palliative care is, what's most important to you? And if it's your faith, well, then that's one of the ways that you're going to cope. Great, if that works for you. And so we would support them with chaplain services or encourage them to have conversations with whomever in their faith community. So I think if it works, it's great. I think a lot of times, though, people do have breaks in their faith as well, and I encourage them to go to their faith community to discuss that, even though that sounds counterintuitive. If you're disappointed or feeling like why has God forsaken me, or those sorts of spiritual existential angst, that they bring it to that faith community for some resolution. But that would be a whole other presentation unto itself as well, which we're happy to have, and there's plenty of people out there who are experts on that, but it plays a huge role.
Thank you. Thank you so much for answering all those questions, and thank you everyone else for joining us, and we truly appreciate you delivering this wonderful presentation.
It's been my pleasure. I really appreciate everyone being here this afternoon, and I hope it's been helpful for you. Thank you so much for having me.
Thank you. And just to add, to help connect patients and caregivers with information and resources that can help support them in their brain tumor journey, please call the ABTA Care Line, which is staffed by caring professionals, at 800-886-2282. Let's pause for just a moment to conclude our webinar recording.